next speaker is going to be Gail DeWald, so I'm going to highlight you. And it is a real pleasure for me to introduce Gail. Not only have I known Gail for, 10 at least years, but I consider her a friend. Gail is a longtime nursing professional.
Well, like she said, my name is Gail, and I am a nurse, a long-term dialysis nurse, and I've known Cher at least 20 years. It's got to be 20.
Has it been 20?
And Lori, maybe a little longer than 20. But here is Gail's selfie when Gail doesn't get any sleep. So I am just like you. I am just hard to live with on those days without sleep. So I would love to hear from you guys in the chat as we go along. Maybe Cher can jump in and say some things on the chat. But anyway, would love to hear from you. I want to know if you feel like that on the days you don't get sleep, because that's the way I feel. So sleep is an essential human need for all of us. And 10 to 30% of adults have chronic insomnia. I have quite a few friends that I chat with on Facebook that are my age and we have insomnia. But up to 73% of patients on dialysis have difficulty sleeping about a third of the time. So that's like every 3 days, difficult sleeping, having trouble sleeping. Everybody knows there's 2 stages of sleep. There's the non-REM and the REM, or rapid eye movement sleep. There are many stages in the REM phase, so, but I'm not going to go into all that detail. But we need that REM sleep to restore our body functions. That is the reason we were created to need sleep. Sleep loss actually alters the body's immune system, and people on dialysis don't need any more alterations to the immune system. So getting good sleep is really helpful. So the causes of sleep loss in people on dialysis are restless leg syndrome, periodic leg movements during sleep, obstructive sleep apnea, and possibly depression. So let us know if you have any of those things in the chat. We're going to go into each one separately. So restless leg syndrome is diagnosed with these 4 symptoms: the urge to move the limbs because they burn or feel prickly. This makes a person want to move their limbs to relieve the sensation. The sensations are always present or worse at rest, and the symptoms increase in the evening or during the night. RLS causes fragmented sleep, and you don't get enough REM time. In 2 studies on people on dialysis, 60 to 84% of the subjects had RLS. That's a huge number of people. The periodic leg movements during sleep, or PLMS, is responsible for sleep problems in up to 72% of people on dialysis. And it's described as a periodic flexion of the ankle, knees, and thighs, and fanning of the toes, like you see here in the picture. It occurs more than 5 times per hour during sleep, and it can be associated with restless leg syndrome. Obstructive sleep apnea is present in up to 60% of people on dialysis and is defined by recurring incidents of low airflow or pauses of breathing. Causes numerous awakenings and daytime drowsiness, like our girl here in front of the computer. And it's diagnosed only by an overnight sleep study. And depression. Depression can happen in up to 50% of people on dialysis. And it may be due to constraints and demands of dialysis. We all know how demanding it is. And it's kind of a blow when you first find out you're going to need dialysis. And depression can usually ensue. So high levels of stress equals poor sleep, and that can be because of finances, family relationships, your diet, fluid, time constraints with your schedule, and also fear of death. So anyone with depression needs to seek help from a healthcare provider if it lasts longer than 2 weeks. So is anyone really listening when you complain about not being able to sleep? Is that doctor or provider listening? So 75% of doctors in a study believe they communicate well, okay? But 21% of the people treated by those doctors said our talk went well. So, only 21% said, yeah, doctor, I understood what you said, while the doctor thought, hey, I did a great job. Okay. So most clinicians are not well trained in sleep disorders. Things to do to improve communication with your provider is to jot down a few notes. When the problem started, how it felt, if you were having pain, and be straightforward and ask open-ended questions. So say something like, I know you're busy, but I need to talk about my sleeping habits or losing sleep. When can we talk? I'm really worried. So if you tell a doctor or a nurse practitioner you're really worried about this problem, their ears will pick up because they're there to help you. They want to help you. You might ask to have a plan of care meeting with your team and bring a friend or family member. So every year, every person on dialysis in the United States is required to have a plan of care meeting. If it's not your turn or your time, you can ask for one yourself. I need to talk to the team. I'd like to sit down and talk about a problem. So when could we schedule that? Or maybe the next time the doctor comes on rounds, I need to have my family member come in. I don't know if that can happen during COVID, maybe not, but at least have the team member come in, maybe the family member on the phone, and see if they can't talk to you about your problems, no matter what it is, sleep or itching or any of that. So be honest and be accurate always with your healthcare providers and give feedback on the clinic surveys that are asking your opinion. Only about a third of the surveys are filled out. Sometimes you get a phone call from the survey company, or the dialysis clinic will hand out a survey. It's really important to give feedback on your clinic and how they're caring for you. Not just complaints, but good stuff too. So they do ask on those surveys, do your doctors communicate with you? Do you have enough staff to care for you? Do they answer your questions, et cetera, et cetera? So those surveys are really important. So this was a study that I found in the Nephrology Nursing Journal, and we're going to look at hemodialysis and peritoneal dialysis patients. And I need to get rid of the screen on the left. I need everyone to go up. I can't see what my slide is saying here, so maybe I can move it. There we go. Okay, so this is the reported, factors reported to prevent sleep in hemodialysis subjects. So they looked at two groups, the hemodialysis group and a PD group. But the first group here said that the number one thing that interrupted their sleep or caused sleep problems was weather. Well, they didn't expand on that, so I'm not exactly sure how that happened, but pain was another. And restless legs was number 3. And you can see pruritus down here. 4% of people said they had pruritus. And sleep hygiene was a problem for 12% of people. And we're going to talk about sleep hygiene in a minute. So in your PD patient, the problems were similar, but the number one problem for keeping the PD patient awake was the machine alarms. So getting to know that machine and being able to wake up when you have an alarm and go back to sleep is a big problem. So that needs to be worked on if you're a home PD patient, and get, help with those alarms, or try and be alarm free, which is sometimes difficult. But restless legs and cramps were number 2, and worries and nerves number 3, and sleep hygiene, 14% of people said they had trouble with sleep hygiene. So COVID-19 and the impact on sleep. Well, we've all had disruptions to work, school, social interactions. It's affected all of us. I had a few days where I sat on the couch and just cried. It was horrible for me to not have socialization. So the biggest impact is that greater than 25% of people have more difficulty falling asleep because of COVID, and 23% say they are waking up more during the night. And that's me. I've had that. I'm better now than I was last year, but it was a big problem. Sleep and stress play a major role in overall health. So this group of professionals here says obtaining healthy sleep is important for both physical and mental health, improving productivity, and overall quality of life. And Dr. Block just talked about quality of life. And if you're having intense itching, your quality of life is just down in the basement. And the same thing if you're not able to sleep. So, quality of life is one of the most important things for our patients on dialysis. So, improving our habits to get better sleep. We're going to talk here about sleep hygiene. Now, I don't know if you have a nice looking bedroom like this, but I have a great bedroom, but it doesn't look quite this nice. But optimize your bedroom environment to promote sleep. You want to make sure you don't have light coming through the windows. You need dark curtains if you do. I often am in hotels when I'm traveling for work, and if there's a light outside my window and I can't get those drapes shut, I have to get a pin or something and pin them shut. So you need darkness, you need quiet, and optimize that bedroom for the promotion of sleep. We also need a daily routine that promotes uninterrupted sleep. So maybe that includes exercise so that you're really tired in the evening and you can start planning your bedtime. Keep a sleep schedule. My husband laughs at me. He knows what time it is when I get up because I go to bed at 10:30. So a sleep schedule is important to me, and getting up at the same time every day is my norm. Make the bedroom comfortable. That's a little different from optimizing the environment, but you want to have a comfortable temperature in the room. Not all of us can afford the 68-degree temperature like the professionals recommend, but you can have a fan on. I know I can't sleep without a fan on, so I bet you all are the same way. I'd love to hear what you have to say about making your bedroom comfortable. And you need a pre-bedroom routine, which might include turning off the TV, taking a warm bath or shower, anything in that realm. And you need to build healthy habits during the day to promote sleep. And consider a sleep tracking device. If you can afford it, they're really great and can tell you how your sleep went. And it's actually something you could show your healthcare professionals if you continue to have problems. Things to avoid. The daytime naps. Here we got the mama and baby kitty here taking a nap. It sounds really comforting, but if you nap during the day, you may not sleep well at night. Shut off those electronics at 30 to 60 minutes before bedtime. And that bright light, use dark curtains. Caffeine, alcohol, and nicotine 3 hours before bedtime can keep you awake. Exercise in the day, but not within 3 hours before bedtime. No jogging before bed. And a large meal too close to bedtime may create problems for you. So I'd love to hear what kind of things you avoid so that you can sleep better. So here we have a young lady that I grabbed this off of Facebook, and her name was Samantha. And she said, ever since I started dialysis, I can't sleep, and it's starting to take a toll on my mind. I cannot function. I've taken melatonin, and that didn't work, and the doctor put me on Ambien. That still didn't work. I explained to him that it didn't, so he subscribed trizolam, 30 milligrams. That's not working either. Am I doing something wrong? I have taken all this at night, right before bed, and 1 hour after dialysis. Are there any remedies that I can try? I know this sounds silly, but I need something. Well, number one, it doesn't sound silly, does it? She has a real problem, and her life is going downhill because she can't sleep. And doctors are really good about, oh, well, if you complain about sleep, I'll give you a sleeping pill. Well, sometimes they work, sometimes they don't. But, again, doctors and nurses like myself aren't well trained on sleep and how to help our patients. So these are some of the responses Samantha got. This guy says, I'm going through exactly what you're going through. Nothing worked. So now they're saying I have sleep apnea. I'm going in Monday for a sleep study. Wish me luck. And this young lady said, try a relaxation app or a meditation app. They will help you reteach yourself on how to go to sleep. Then this lady says, I have a weighted blanket. Or have you tried a weighted blanket? And Samantha says, no, I haven't. And she said, I swear by mine. So some great ideas. I'd love to hear your ideas in the chat. So we would love to hear your thoughts for sweet dreams and healthy days. And my last slide are a couple of sleepy bears at the zoo. So thank you for having me. I'd love to hear what was in the chat, Cher.
Well, thank you very much, Gail. I will say that I myself, right after I started dialysis, I had a rocky road to starting dialysis. I did chemotherapy first because I have an autoimmune disease, and I was having trouble sleeping, and I did go on an antidepressant for about 3 months, and it helped me get over that hump. But since my transplant, I've had doctors prescribe Ambien. I was on a trip once, and you hear crazy things about people who take Ambien sometimes. And I was talking to somebody on the phone, and I didn't even know I fell asleep. The next day, they called me up, and they said, "Where'd you go?" So, of course, some things work for some people, and some things work for others, right?
Right.
But one of the participants would like to know, is Tylenol PM an option?
Tylenol PM is an option. I would always ask the doctor if your healthcare provider, might be a nurse practitioner, a PA, or a doctor, but ask them if that is something they approve of for you. We just heard Dr. Block talk about Benadryl, and there is Benadryl in Tylenol PM, and it does help you sleep. He said it doesn't really help with itching, but it could help you sleep. But I would always go through your healthcare provider to make sure they're okay with that.
Okay, great. Someone uses a sound machine to hear rainfalls. I think that's wonderful. I find that very soothing. But sometimes if I've had an unusually stressful day, sometimes even that will keep me awake, and I end up turning it off. So I'm trying one thing after the other. And I wish that my bedroom looked like the one in your picture. Yes. It certainly looks like it's very conducive to a good night's sleep. And let's see.
I do think that the sound machine is a great idea.
I do too. I do too. At RSM, we're big big pet fans here. So
Yes.
Lori, Suzette, myself, Isela, we all love animals. And speaking of animals, somebody mentioned, and I go through this too, I get my best sleep when my cat is with me.
Oh, there you go.
Isn't that sweet?
And that's perfectly safe.
Definitely, definitely. One person said that he has no problem sleeping at all, and he could sleep for 24/7 if he could. Um, that can be something, though. That could be an indication of depression too, couldn't it?
Yes.
I mean, it's not just, I mean, what I've observed with people over all these years, that if they're sleeping all day, they tend to be up all night.
Mm-hmm.
And then it just
That's
becomes a vicious kind of a cycle. And
I'm thinking your respondent was probably joking a little bit, but some people can nap and still sleep all night, and I envy them. I am not a napper. If I'm napping, I'm sick. So you have to know your own body and that kind of thing.
Right, right. I would like to thank you for reminding us to fill out surveys, because I think sometimes that our voices aren't heard. But as an administrator, you know that's not true, that a lot of times that's the only way we're heard, if we fill out a survey, right? I mean,
that's right.
We have to let you know how we're responding to things, and then also developing a plan of care. Whenever people feel like they're not getting enough dialysis, or they just feel bad, maybe they don't know that they're not getting enough dialysis, or they've been skipping. I think that people forget, hey, we can request to have this meeting with our doctors and review everything. And isn't that the perfect time to say, oh, by the way, I'm not sleeping either. What can we do?
Yes. And make notes if you're going to go to one of those meetings. Have your questions all written down.
Sure.
Just like all of us, we go see our doctor, we got questions, you have to write them down or you forget.
Right, right. One of the participants wants to know, what about the dyes in certain medications like Tylenol PM? It's blue, and she wants to know, is that harmful at all?
That didn't come across anything I looked at preparing for this presentation. Again, you might, if the name of the dye is written, you might look it up. There's all kind of apps now. You can look up different chemical compounds, and the ones that are safe and ones that may not be safe, or ones that can, or dyes, and might cause problems for certain people. So my husband has allergies, and he has an app that when he goes to the store to buy any kind of lotion or emollient cream, he looks it up to see if that one's okay for him. So there's all kind of apps out there nowadays that help us navigate life, So
Right. And maybe just asking your pharmacist, right? I mean, they might have good advice too. Right. One person made a comment that they sleep in a recliner due to hip pain, and that helps sleeping well. I know as a PD patient myself, I spent a lot of nights in a recliner. And then we have somebody else who says that she's in her first week of PD, and she noticed that she sleeps much better when I dwell during sleep. I also do bedtime yoga and try to maintain good sleep hygiene. No reading, watching TV in my bedroom. Also exposure to daylight for 20 to 30 minutes first thing in the morning before coffee. I think that she's probably doing all the right things, isn't she?
Sounds like she's got a great pattern for her day. That sounds great.
Well, perfect. I know whenever I was on PD, the light would keep me awake sometimes, and I would just take a light towel, like a washcloth, a dry one, and put it on over the lights, just so it took some of that glare off. It was me trying to get rid of any light sources in my room, just like you said that you had difficulty with. But Gail, thank you so much for sharing your expertise. It is always lovely to see you. Well, and thank you. We have to get together again sometime soon, right?
Okay. Come on
All
over.
right. Well, thank you very much for coming, Gail. We'd really appreciate it.
Thank you for having me. Bye-bye.
And a shout out to our corporate mission partners for making this happen.